Let's look into the anatomical and physiological aspect at the cellular level. Here we have a blood vessels, few cells, and the yellow space between them is known as the interstitial space. Let's label them accordingly. First, edema occurs when there is an imbalance between the intravascular hydrostatic pressure and the oncotic pressure, as we elaborated right now. Here we can see an intravascular compartment. It comprises of two forces. First, the hydrostatic pressure, which is also known as the pushing force. It causes the fluid to move outside the vascular compartment into the interstitial space. Second, we have the oncotic pressure, also known as the pulling force. These pressures help to keep the fluid inside the intravascular compartment, sometimes also facilitating the inward movement of the fluid from the interstitial space. Edema occurs when there is an increase in the hydrostatic pressure, forcing the fluid to move outside, or a decrease in the oncotic pressure, which does not keep the fluid inside the vessel. When this fluid moves out in the interstitial space from the intravascular compartment, this causes excessive collection of fluid in the interstitial space and hence the edema. This excessive collection of fluid in the interstitial space is drained by a specialized system in the body which carries fluid from the interstitial space towards the venous system and drains into it. This specialized system which drains the fluid from the interstitial space into the venous system is known as the lymphatic system. Any abnormalities in the draining of the lymphatic system can also cause an increase in the hydrostatic pressure and causing edema. This can be due to obstruction or by removal of any local lymph nodes as seen in the illustration. There is another mechanism in which excessive fluid can be accumulated outside the vascular system. This is in the process of inflammation. Here we have a blood vessel which is lined up by endothelial cells. Whenever inflammation process is occurring in the body, it increases the permeability of this tightly bound cells, hence facilitating the outside movement of the fluid into the interstitial space. This is inflammatory edema. Now let's revise. Edema is defined as the collection of fluid in the interstitial space due to the movement from the intravascular compartment to the extravascular compartment. This can be due to increase in the hydrostatic pressure, which causes the fluid to move outside, a decrease in the oncotic pressure, which causes failure of the fluid to remain inside. Also, defect in the lymphatic system causes defect in the drainage from the interstitial space. And finally, in inflammatory process, increasing the permeability of the cell. Edema in the body can be visualized at many parts. Gravity plays an important role in localizing which part of the body will have the edema. For example, in supine position, gravity is always acting in the downward force. Hence, the most dependent part are the feet. Here, we will appreciate pedal edema. In bedridden patients, the most dependent part are the sacral region and the scapular region. In these patients, we will appreciate edema in the sacral region. Gravitational force plays an important role in edema caused due to hydrostatic pressure. In edemas due to hypoproteinemia, which is decrease in the oncotic pressure, that is failure of the fluid to stay inside, the fluid moves outside the intravascular system with or without the assistance of gravity and favors the collection of fluid in the loose subcutaneous tissue such as the periorbital region. This collection of fluid thus gives a moon face-like pattern when the patient gets up early morning, which can be appreciated as the puffiness of the face. Edema generally is of two types, pitting and non-pitting. Let's discuss pitting edema. This can be due to two mechanisms, increase in the hydrostatic pressure or decrease in the oncotic pressure. Imagine you sitting idle, getting bored, and you get two options. One, to study, another, to play game on your mobile phone. Your parents and teachers have to really push you hard to study. but the video game will pull you towards you. Hence, to push the fluid out to fill the dimple, it's gonna take time. Hence, it is known as the slow edema. Rather, when the fluid moves on its own, it's gonna recover really fast. Hence, this is known as the fast edema. The slow and the fast edema is of the recovery time taken for the dimple to fill again with fluid with respect to 40 seconds. If it takes more than 40 seconds, it is considered slow recovering edema. If it takes less than 40 seconds, it is a fast recovering edema. Let's look into some causes causing increase in the hydrostatic pressure. They can be divided into two parts. One, generalized increase in the vascular pressure. This can be due to systemic hypertension, congestive heart failure. In congestive heart failure, the heart pumps to fill the blood forward. Hence, there is an increase in the back pressure, increasing the pressure of the systemic circulation, and hence causes increase in hydrostatic pressure. Third, pericarditis and tricuspid valve disorders. In the tricuspid valve, similar pathology occurs. Due to the failure, it causes a back pressure in the systemic system. Other causes of increase in the hydrostatic pressure can be localized to a certain region of the body. This can be seen in situations like deep vein thrombosis and inferior vena cava syndrome. In edema due to hydrostatic pressure, the protein content of the body is normal. But in edema due to decreased oncotic pressure, the protein content in the body is significantly decreased. This can be due to excessive loss, such as in the nephrotic syndrome, where the protein is lost with the urine, known as proteinuria. Such circumstances can also be seen in conditions such as bowel disease and burns. Hypoproteinemia can be also due to decreased intake of protein in conditions such as malabsorption. Liver disease, also the synthesis is decreased in liver disease. And third, in severe malnutrition, such as Kwashiorkor's disease. Let's now discuss non-pitting edema. These are mostly due to defect in the lymphatic system. When the lymphatic system fails to drain the excessive fluid present in the interstitial tissue, it causes increase in the pressure inside the lymphatic system, forcing the fluid to move outside. Along with the fluid, some amount of protein is also moved outside into the interstitial space. The presence of these proteins and the fluid for a long period of time in the interstitial space causes changes in the skin known as hyperkeratosis, as seen in the image below. These are known as non-pitting edema because they fail to form a bump on pressing, as the fluid cannot be displaced inside. Here, let's just have a look for the different causes of non-pitting edema. In the lower limb, they can be seen in filariasis, where there is lymphatic blockage, in aplasia cutis, that is congenital absence of the skin, in congenital disorders where the lymphatics are absent, in malignancies. In the upper limb, breast cancer surgeries can be associated with removal of local lymph nodes. In radiation therapy, and the other causes such as myxedema found in hypothyroidism and pretibial myxedema found in hyperthyroidism, where there is deposition of hyaluronic acid in the dermis and the subcutaneous tissue. Also, some medications such as nifedipine, corticosteroids and NSAIDs causes non-pitting edema. Another type of edema whose cause is not known, hence known as the idiopathic edema. It's present in females less than 50 years of age. It is chronic, bilateral and pitting in type, occurring mostly during her menses. Now discussing the next type, the inflammatory edema. Inflammatory edema is due to the increased permeability of the blood vessels, which causes intravascular fluid to seep outside into the interstitial space. Being inflammatory in nature, it will show the four primary components of inflammation: heat, which is calor; pain, which is dolor; redness, which is rubor; and swelling, which is tumor, as seen in the image. This Such a state can lead to cellulitis, a condition where there is inflammation of the subcutaneous connective tissue. Summing it up, these are the various kinds of etiopathogenesis and mechanism by which edema can occur in the body. Thank you.